Healthy-ojas presents you this video on A1C test benefits. A1C test helps best understand diabetes treatment, manage diabetes better and prevent diabetes complications. What are A1C test benefits? A1C test has numerous benefits. They are: check self-testing results. A1C tests help how correctly you are doing self-monitoring. Even many errors in your home glucose test became known and help you to correct it. Value for your money, time and efforts. Assess diabetes treatment, how well it is going on. Help confirm whether the ongoing treatment regimen suits you or need any modification. If your A1C result is not within the target, then you may need to change for more effective diabetes treatment. Fix healthy choices. A1C not only helps assess your diabetes medication, additionally, help to assess other lifestyle changes you have just adopted. Improve diabetes treatment. Once you have achieved your target A1C, then you can try for more stringent targets and improvise your treatment plan to achieve it. Avoid diabetes complications. Achieving good A1C range will stop various diabetes complications such as nerve damage, eye problems, oral problems, heart attack, sexual dysfunction, and depression. Diagnose prediabetes and diabetes. A1C test can be a useful tool for early diagnosis of prediabetes and diabetes. Additionally, if your A1C is not in a healthy range, then you can change your lifestyle to stop its progression towards prediabetes and later to diabetes. A1C test to diagnose prediabetes and type 2 diabetes. International Organization recommends A1C test as one of the tests to diagnose prediabetes and type 2 diabetes. A1C test provides average blood glucose levels of last 3 months. The blood glucose test only provides a glucose level at that instant based on what you have ate on past hours, stress level, sleep quality, and any illness that may cause a false high or low blood sugar level. Diabetes type 2 develops slowly for months. During this period your blood glucose level may fluctuate largely, and you may miss out the high level. A1C shows the 3-month average, thus it helps early diagnosis of diabetes. Still, impaired glucose tolerance and impaired fasting glucose tests are important tests for diabetes diagnosis. Because A1C has some drawbacks due to anemia or other conditions causing false, low and high in some individuals. An A1C percentage is useful in diagnosis of diabetes. The result range and its meaning is: optimal 4.1 to 4.6%, suboptimal 4.7 to 5.1%, normal 5.2 to 5.6%, prediabetes 5.7 to 6.4%, diabetes 6.5% and over. Many studies confirm the importance of A1C test to avoid diabetes complications. A1C test is a well-established way to determine your historical glycemic control. A1C has a strong relationship with the blood glucose level. Increase in glucose level will reflect in an increase in A1C. The link between A1C levels and the risk towards diabetes complications in diabetes patients, both type 1 and 2, is established by some of the popular studies, such as the Diabetes Control and Complications Trial, DCCT study findings. Intensive blood glucose control reduces the risk of eye disease by 76%, kidney disease by 50%, and nerve disease by 60%. In participants who had some eye damage at the beginning of the study, tight management slowed the progression of the disease by 54%. The United Kingdom Prospective Diabetes Study, UKPDS data showed a continuous relationship between the risks of microvascular complications and glycemia, such that for every percentage point decrease in HbA1c, for example, 9 to 8%, there was a 35% reduction in the risk of complications. Epidemiology of Diabetes Interventions and Complications, EDIC study findings. Intensive blood glucose control reduces the risk of any cardiovascular disease events by 42%, non-fatal heart attack, stroke, or death from cardiovascular causes by 57%. Norfolk cohort of European Prospective Investigation of Cancer and Nutrition, Epic Norfolk study shows that those people with a 6% considered normal compared to those with a 5% had a 28% increase in cardiovascular death. Subscribe to our video channel for interesting videos and visit Healthy-ojas.com for useful information on diabetes, cholesterol, high and low blood pressure, eye and sleep problems.